Male menopause is thought to be down to a testosterone deficiency that develops later in life. Dr. Jeff Foster has been researching this for several years and is with us this morning. Dr. Foster, good morning to you. Thank you for coming on the show this morning. I guess that the first question that I want to ask you about is I had no idea that this was something that males could go through. Do we talk about this enough?
No, clearly. The fact we're having this conversation now suggests we're not talking about it enough. I mean, we've literally got decades and decades worth of data that shows that men that have low testosterone do less well in multiple aspects of their life, in terms of how they feel, in terms of their risk of other diseases, just in terms of their long-term output. But for some reason, it's kind of trivialized, like it's a male menopause. It's kind of like a funny little thing that we shouldn't really take seriously.
So what are your thoughts on East Midlands Ambulance Service? They're giving up to a year off for any male worker who's experiencing mood swings and depression. Are they leading the way with this?
I think that's a mixed one. I personally think that any employer that is taking the time and the effort to recognise the fact that men suffer with this condition is amazing. And that's a step forward to something that we've just literally not seen before. Whether that needs a whole year's worth of sick leave pay, I don't know. And I think from my side, we have about 800 patients on our clinic list. And I think most of those we can usually get satisfactory symptom control within around 3 months or so. So you shouldn't normally need to have a year off. I mean, there may be extenuating circumstances, but perhaps simply a good comparison is with menopause in women. And maybe 10 years ago, you were told, well, if you just had menopause, you deal with it. It's just a normal thing. So suck it up and expect that's how it's going to be. And of course, all these hundreds of thousands of women were struggling. Now we have HRT, much better promoted, and some really good doctors and celebrities who've kind of pushed menopause to the forefront. We don't really have the same for men. And bearing in mind we've got nearly 1 million men in the UK have low testosterone. A quarter of all men are going to get it at some point in their lives. So it's not an uncommon problem, but maybe we just need to start talking about it more. So this is perfect.
Why does it occur? Why does this happen?
So we naturally peak our testosterone levels at the age of about 30. And then you're going to naturally drop it by about 1 to 2% a year, whether you do anything or not. And if you're lucky, you might have been born with a really high level and you might never know. You carry on until the end of your life, you had great levels, it's fine. If you were somebody that maybe had not such high levels naturally, you never got quite as much, or maybe other things in your life, so certain medical problems, or if you took medications or certain lifestyle issues, they can all chip away. And the next thing you know, you're a guy in your mid-30s or 40s or 50s or whatever, and you start to get symptoms of low testosterone. The problem is that whereas menopause is more typically at the age of about 45, 55, around that, with testosterone in guys, we don't know when you're going to get it because it's much more random and it's much more susceptible to things in lifestyle. So you get anything from, our youngest patient's 23, my oldest patient's about 87. So it's really a disease of all ages.
What should we be looking out for then? If you're concerned about your partner perhaps, or a parent or somebody that you live with, what are the symptoms? What do we need to be aware of?
The biggest thing is that most of the symptoms are usually just trivialized as fitting a cultural narrative of this is normal because you're a middle-aged guy. So a lot of the symptoms are things like, I just feel a bit more tired than I used to be. I've lost my get up and go. Partners often say that my partner's become more grumpy. He's more miserable than he used to be. He's lost his enjoyment for life. You might find that you're going to work and you just don't care about it anymore. Your motivation to get it changes. You find that when you go to the gym, whereas you used to be able to put on muscle, you can't do that anymore. You seem to be putting on body fat, even though you eat the same amount of food. Nothing changes. Libido drops a little bit. And you might even find you start to get erectile dysfunction, although you don't have to. And as it gets worse, guys start to complain of brain fog. You can even get night sweats. You have an increased risk of osteoporosis, but that's the more sort of extreme stuff. The more common symptoms you're going to get are just feeling you've got older and all that lust and enjoyment for life has just disappeared.
Jeff, I'd love to talk about this further with you when we've got a little bit more time. Perhaps come out and see you and have a chat. In the meantime, if people listening today thinking, this is Dr. Foster is explaining exactly what I'm going through at the minute. This is exactly what I'm experiencing with, and I can't put my finger on it. I don't know what the matter with me is. What would you suggest people to do? Where should they go for help?
So currently, and this is where it gets a little more frustrating, most of the NHS is not particularly well kitted up for treating or managing low testosterone in men. And it mimics, again, where menopause was 10, 15 years ago. This is down to an education issue and it's down to a funding issue. So I think by all means, starting point is your GP, and that's a great option. But quite reasonably, they might say, well, we don't have a lot of expertise in this. And if those levels come back normal on your blood test, that doesn't actually mean you don't have low testosterone. It just means they haven't done the correct test necessarily. The next step I'd suggest is if you look at, well, my website, so Dr. Jeff Foster or h3health.co.uk, we provide lots of free information for patients where they can get information on low testosterone. And then it's about trying to find a men's health specialist who might be able to help you in that area, because there aren't many of us.
Jeff, thank you ever so much for your time and for helping us raise awareness and for talking about that as well. Dr. Jeff Foster joining us this morning here on BBC Radio Leicester, talking there about the male menopause. I had no idea that that was a thing.